Welcome to our presentation on implicit bias, focusing on understanding and mitigating unconscious prejudice. This session will explore the impact of implicit bias in professional settings, particularly in healthcare. Let's delve into how these biases form and how we can address them effectively. Our learning goals include understanding the psychological origins of implicit bias, recognizing its impact in healthcare and education, and developing strategies to mitigate these biases. By the end of this session, you'll be equipped with evidence-based approaches to address unconscious prejudice in your professional practice. Implicit bias is a natural cognitive process representing the brain's pattern recognition system. These unconscious influences affect behavior and decisions without our awareness. Tools like the implicit association test help detect and quantify these biases, making them a measurable phenomenon. Research shows evidence of bias in healthcare. Studies by Sobin et al. Reveal implicit preferences among physicians, affecting diagnostic decisions and patient interactions. These biases can lead to varied communication quality, impacting patient care and outcomes. In cardiovascular care, implicit bias leads to unequal treatment. Studies show Black patients receive fewer thrombolytics, despite similar indications. Green et al. Found implicit bias stronger than explicit bias in predicting care, affecting clinical decisions and life-saving treatments. In oncology, implicit bias affects patient interactions. Oncologists spend 22% less time with Black patients, with communication quality decreasing by 33%. Penner et al. Highlight increased hesitation, showing how bias impacts critical cancer care communication. Bias in names and perception is evident in various studies. Gender bias shows male pseudonyms receive more favorable reviews. Racial bias affects academic opportunities for Black-sounding names. Combined effects show intersectional identities face compounded biases. Bias manifests in several ways. Nonverbal cues like reduced eye contact, verbal indicators such as increased speech errors, cognitive processing through biased frameworks, and professional impacts on candidate selection and treatment decisions. Recognizing these signs is crucial. Bias in admissions is prevalent. Ohio State University College of Medicine found biases like race preference and academic prestige using IAT assessments. Understanding these biases helps in creating fairer admission processes and promoting diversity in educational settings. Bias mitigation training has a significant impact. Studies show increased diversity, enhanced inclusion, and changed outcomes post-training. Capers, Devine, and Carney's demonstrate measurable improvements in workplace climate and decision-making, highlighting the importance of such interventions. Mitigation strategies include forming common identities, perspective-taking, considering the opposite, and using counter-stereotypical exemplars. These approaches help challenge initial assumptions and promote a more inclusive environment by focusing on shared goals and diverse perspectives. In the admissions scenario, Williams' profile highlights potential biases like academic prestige and geographic stereotypes. Recognizing these biases allows for a fairer evaluation process, ensuring candidates are assessed based on merit and potential rather than preconceived notions. For transplant candidate Mr. Jenkins, biases may arise from race and socioeconomic factors. By identifying these biases and applying perspective-taking, we can better understand barriers to compliance and improve patient care and decision-making processes. In evaluating fellowship candidate Naima, consider intersectional biases related to race, gender, religion, and cultural background. Acknowledging these factors ensures a comprehensive assessment, promoting diversity and inclusion in research and academic opportunities. Dr. Lee's profile as a university president challenges stereotypes. Her achievements and leadership style may be subject to gender and cultural biases. By examining these assumptions, we can appreciate diverse leadership profiles and foster an inclusive academic environment. Your action plan involves identifying potential biases, selecting a mitigation strategy, implementing it during interactions, and reflecting on the outcomes. This cycle helps refine your approach, promoting continuous improvement in addressing implicit biases. In conclusion, implicit biases are a universal phenomenon. Through conscious effort and awareness, we can intervene and create change. Bias mitigation leads to better outcomes, enhancing care quality and educational equity. Thank you for your commitment to this important work.